The mind is a very powerful thing. It can convince you to do things you never thought you would do. It can make you believe things that aren't true. Mental health is a very overpowering thing. It can affect everything from your day-to-day life to your future life. There has been shown a clear connection between mental health issues leading to other problems, such as eating disorders. Eating disorders are born out of complicated mental health issues, which involve a combination of obsessive thoughts and compulsive behaviors, such as one's body image, food intake, and purging mechanisms. The most common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa results in severe weight loss, distorted body image, an intense fear of gaining weight, and pathological dieting. Bulimia nervosa is when someone eats too much to then throw it up, use laxatives in an abusive manner, or implement excessive exercising to avoid the weight gain. Binge eating disorder is recurring moments of uncontrolled eating, very large amounts of eating, with a sense of loss of control. These eating disorders are known as the deadliest mental health disorders. Eating disorders are very complex conditions that can result from multiple causes. Mental health is a big cause in the development of eating disorders. While all eating disorders include issues with weight and food, most experts are now starting to see the link with eating disorders and mental health. From NAMI.org, most experts now believe that eating disorders are caused by people attempting to cope with overwhelming feelings and painful emotions by controlling their food. Sometimes these overwhelming feelings and painful emotions can be so detrimental that the only way someone feels they can control what is going on is by controlling their food and weight, leading to very harmful effects. It isn't strange that many people have issues with mental health, especially considering the world and society we live in today. According to the National Institute of Mental Health, in 2019, there were approximately 51.5 million adults, ages 18 or over, in the United States with some type of mental health disorder. That's about 20.6% of all US adults. This also showed that it was seen more among females than in men, and majority was young adults who had the highest prevalence with an AMI. This shouldn't come as a shock to many because the amount of stressors and pressure being put on people have been significantly rising in the past years. That being said, the statistics regarding eating disorders aren't that surprising either. According to ANAD, the National Association for Anorexia Nervosa and Associated Disorders, 28.2% of Americans will have an eating disorder in their lifetime. 10,200 deaths each year occur as a direct result of an eating disorder. That's one death every 52 minutes. These percentages start and will only increase without proper help from a young age. 42% of 1st to 3rd grade girls want to be thinner. 81% of 10-year-old children are scared of being fat. And 46% of 9 to 11-year-olds are sometimes or often on diets. These statistics are disgusting, and unfortunately, these feelings will only stay with them. It has been shown that 35 to 57% of adolescent girls will engage in one of the following: crash dieting, fasting, self-induced vomiting, diet pills, or laxatives. A study done in 2010 on a college campus did a survey where they found that 91% of women on that campus have tried to control their weight through dieting or one of the other methods listed. It is important that people understand the connection between mental health and eating disorders because it can clarify the reasons for the type of eating disorder they may have. What many people do not recognize is the connection of these issues, which, when go unnoticed, can lead to an unnecessary amount of medication. An example of this is from Fairhaven, TC. 33 to 50% of anorexia patients also have a mood disorder, such as depression. Once someone recognizes the underlying problems, then they can start addressing and adhering towards the symptoms of the illness. Around half of anorexia and bulimia patients also suffer from one or more anxiety disorder. Poor mental health symptoms produce feelings of guilt or suffering, which then lead to over or under eating as an attempt to self-medicate. However, if these connections are found quicker, it may stop these progressions, leading to less extreme feelings and a lower amount of mental health issues. Mainstream media does not help the symptoms of eating disorder and mental health. For so long, and targeted mainly towards women, social media and other media platforms have portrayed what the quote-unquote perfect woman or person should act and look like. These stereotypes can have long-lasting consequences, such as an eating disorder, in order to fit what society tells you to look like. An example of these consequences is Helena. Her story is found in Understanding Mental Disorders, Your Guide to DSM-5. During Helena's teenage years, she had been of normal weight, but worried a lot about her body weight and shape. As a lot of young girls do, she compared herself and her body weight to other girls or women she knew or saw, leading her to judge herself too harshly. Helena did a lot of things that most people with body image issues did. She would pinch the fat on her sides and notice that her thighs would touch each other. She started her first diet at 14, then at 15 decided she would become a vegetarian and cut many foods out of her diet. At the age of 15, she weighed 125 pounds. By the time her 16th birthday had come around, she had dropped 110 pounds. A lot of people who notice dramatic weight loss with an eating disorder think that it has done nothing, and they are still heavy or not the look that they want. This happened with Helena. Helena would weigh herself throughout the day and started isolating herself from her friends, spending too much time concerning herself about her weight. Her parents started noticing these big changes in their daughter and started watching her and her eating habits more closely. With no success in urging her to eat more, she kept losing weight and around 6 months later weighed 98 pounds. Being this weight, Helena appeared very thin. She was often withdrawn, distracted, and hard to speak with. She did heavy exercises every day and could not sit and relax. She had to be standing and pacing. Eventually, Helena's parents took her to a doctor who diagnosed her with anorexia nervosa. It is people such as Helena who need to understand where these feelings come from in order to properly help themselves. If her parents did not notice these drastic changes in her and did not notify a doctor, Helena could have caused even more physical and mental problems within her, which can sometimes lead to death. However, there are many challenges when it comes to treating eating disorders. When treating children, the challenges include their psychological immaturity and a sense of urgency. Because they are so young, they are not fully matured and do not have fully developed cognitive and emotional skills. Because of this, they cannot undergo adult-level expectations of treatment. It is important to take action immediately, no matter what their intrinsic motivation may be. Sense of urgency within a child is a challenge because it is important to get the child back to their normal developmental pathway, because if delayed, it can cause issues for their future growth and development. For all ages when treating eating disorders, it is necessary to make sure that the patient does not feel alone. Having an eating disorder can make someone feel as if they are battling this alone and that no one understands their struggles. These feelings can cause them to backslide into their old eating habits. That is why a lot of doctors recommend going to therapy, support groups, faith groups, or even practicing in online groups, forums, and discussions. A lot of time, people who successfully finish treatment in eating disorders experience some temporary backsliding. Another difficulty in treating eating disorders is that the patient often has made repeated attempts. If the patient believes that the first treatment did not work, they think it will never work, and this feeling of failure can make the problem that much worse. Another challenge of treating eating disorders is that if a treatment does not work, the patient will blame themselves. They do not understand that just because this type of treatment didn't work doesn't mean other treatments won't work. Not every type of treatment works for every patient. According to healthyplace.com, treating eating disorders does not have a single path. Each person needs to find a specific treatment that works for them. The final challenge I will speak about regarding treating eating disorders is self-doubt. Defeating an eating disorder is a very big commitment and often a difficult one to make. It is normal for patients to doubt if the result of treatment is worth all the work. They have to learn that treating an eating disorder is giving the victim their life back, so that they can feel free from the dangers that may come with food. To end this, I would like to restate that mental health issues can lead to eating disorders. I want to reinforce to all victims and survivors of an eating disorder that this is not the end. Even though you may feel like it, You can and will get through it. From one victim to everyone else, we got this.